Thanks for staying with us on our healthy segment on Tuesday. We'll be discussing scoliosis, which is the curvature of the spine. And joining us on the show is a consultant, orthopedic and spine surgeon, Dr. Adetunji TOLUSE. Welcome to the show.
Welcome to the show, sir.
So when we hear scoliosis, we just wonder, what exactly is it?
Okay, right. So scoliosis is a lateral curvature of the spine. To put it simply, the spine is bent sideways.
Okay.
There's a side bending of the spine when you look at it from the frontal view.
Okay.
Normally, our spine, when we're standing straight upright, the spine should be straight. But in scoliosis, there's a bend to the side. There's a lateral bending, lateral curvature of the spine.
Okay, so is it a birth defect?
Right. In some instances, it can be. I mean, so we classify scoliosis as idiopathic, which is the commonest. That is of no known cause, and usually that begins to develop about the age of adolescence. So we begin to see from about the age of 10, between 10 and 15.
Wow.
That's when we commonly see that, and that's what we see being displayed on the screen. So that's the commonest variant of scoliosis. The inborn variant is less common, but that also occurs.
But can you stop it from getting worse, especially as it happens before puberty, when the bones are still, the person is still young, not still tender? What can be done?
Exactly. So the whole idea of creating enlightenment about scoliosis, because like I said, it's seen amongst adolescents from about the age of 10, and it's commoner among girls, so among the girl child. So the ratio is about 4:1. Some studies have reported 7:1. That is for every 7 girls that you see, you only find maybe just 1 boy. So it's far more common in girls, and it's worldwide, so it's not peculiar to us as blacks, or regardless of skin color, whether you're black or white or whatever your skin color is, it's a global thing. So one of the ways around it is early detection. So if it's detected early, then there are modalities of care to slow down the progression. Because usually about the age of adolescence, that's when we have the growth spot, the pubertal growth spot, when the girl child begins to grow and then begins to develop the secondary sexual characteristics, and then height, there's increase in height. So the curvature worsens and they become quite bent. And so, so the thing really is about picking it early, so that if possible, in a large number of cases, we are able to avoid surgery.
Okay.
Right.
So one of my worries when I saw, I've seen this in a few materials before now, I always felt like maybe it was based on dietary deficiencies. Maybe they didn't eat right, or like the one where you see rickets, like maybe they are dietary deficiencies, they're not having enough calcium, or they are not, maybe they did not sleep in a right position. I just always feel like it's something external. Is any of this true? And what do you think are the things that might predispose someone to having scoliosis?
So as we are talking about this, the commonest variant, the idiopathic one, now some of those things you've mentioned really are not the cause of scoliosis. So it has nothing to do with diet. Now, one of the other things that parents have suspected to, they think, oh, because the children carry backpacks, now the load on the backpack is the reason for the bending of the spine. No, they are not causative factors, not at all. So it has nothing to do with diet. It has nothing to do with what the child has been doing, whether the child is active in school, in athletics and sports, or gymnastics, or carrying heavy bags. It has nothing to do with any of that. It has nothing to do with intake of calcium. And also, it also has nothing to do with, like I said, it's about the pubertal growth spot. Parents have to think, oh, because she's beginning to grow, so the girl child is forming adulthood, or beginning, maybe it's trying to go wild and beginning to pose and they say, oh, okay, she's beginning to pose because she's beginning to develop, the breast is beginning to form, so she's beginning to pose and tilting one way. So they say, no, tilt right. And so often,
is it more common in women? Because you keep saying she.
Yeah, that was
it's far commoner in the girl child.
Yeah. Wow.
Far more common in the girl child than the boy.
So my question is, how does a parent observe? I mean, what do you look out for? And how early can you pick out the symptoms before it gets to the age of 10? I mean, is that something that can be done before then, or the child must mature to at least 10 to be able to have some kind of a corrective measure?
No, not exactly. So I could dial back a little. So we'll talk about scoliosis. So I'm talking about the adolescent variant.
Okay.
Then we also talk about the early onset. That's where the scoliosis develops before the age of 9 and below.
Okay.
So in those variants, we call them the early onset scoliosis.
Okay.
While the adolescent variants, that's the one from age 10 and above.
Okay.
So those ones are, like I said, the ones 10 and above, that's the commonest variant of scoliosis. But in some instances, these things can be picked earlier. So the real thing is all about being observant. Usually, oftentimes, it's the parents that pick, the mother that picks it possibly while looking at the child dressing up. They realize that, oh, the girl child she's tilting to one side, one shoulder is higher than the other, or one rib, the scapula, particularly on the right side, is more prominent than the other one. So it's all about being observant about these things. In some instances, too, it's picked up in the school by the teacher. I know in other climes, it's not that prevalent in our environment. In other climes, they do what they call school screening. So they screen children for scoliosis because it's something that can be easily picked. You don't really need to, it's just by observation.
Yeah.
You really don't need any fantastic gadgets. And once you suspect, then you go to the hospital for assessment by the doctor to then determine whether there is scoliosis.
But there was something you said I wanted us to go back to. You said it's more common in adolescence. Now,
Yes.
is it that a child grows up normally, her
Yes.
spine is fine, then she gets to age 10, and then it begins to bend?
Exactly.
So that means that if you have been raising your child and you didn't notice anything, you'll be wondering what happened. So it starts from that age, you're saying?
Exactly.
Oh, wow.
So in adolescent variant, the child has been normal all the while, and then from about that age 10, 11, the spine begins to bend.
Oh, wow.
So you talked about surgery. So after this, so can surgery correct that?
Right. So with management of scoliosis, there's the surgical management, then there's the non-surgical management.
Okay.
So usually with the idea is to pick it early and as much as possible try to avoid surgery. There are braces that can be placed, that can be adapted for the patient to arrest or to slow down the growth, the worsening, the progression of the curve. So, but so we measure these things. So depending on the magnitude of the curve, that determines what we do. Usually the recommendation, once the curve is above 50 degrees, then you want to offer surgery. That's the universal recommendation. That's the standard of care. So you want to prevent the curve from getting to that magnitude. But in some instances, like in our environment, oftentimes, by the time patients present, it's way beyond that. And then we have no other alternative than to offer surgery. But sometimes, too, we pick them early. Some parents are quite observant. I've seen cases presenting with 15 degrees, 20 degrees, because usually the mother, quite observant, or sometimes it's a sibling. Possibly the girl has an older sister or a younger one who's observant that there's something wrong here, then reports to the mom. Hey, I saw her back is this way, and then the mother looks, and then the next thing they come to the hospital.
But does the surgery straighten the spine? Does the surgery straighten the spine? That's what I'm
Right.
asking.
So the goal of surgery, when we talk about surgery for scoliosis, the goal of surgery is not to achieve a perfectly straight spine. Yes, sometimes we achieve that, but the primary goal is to reduce the magnitude of the curve and then stop the progression. Because if we do nothing, particularly when it's above 50 degrees, it will keep progressing even into adulthood. And then that would then have impact on the health of the patient. So you want to, the surgery is to reduce the magnitude of the curve, stop the progression of the curve, and then improve the cosmesis, and then give the patient a stable, balanced spine.
Okay, so if it's not treated, what could happen in the future? What are the future risks if it's not treated?
Right. So if it's not treated, particularly where the magnitude is more than 50 degrees, it keeps progressing. Usually it progresses about the age of, about 1 degree per year. So as that further progresses, because the spine is bent out of shape, arthritis will set in much earlier with back pain. Then, of course, to depend on the magnitude, if it's quite severe, because we know in the chest cavity, that's where we have the lungs and the heart. So that will impair that will impact on the patient's ability to breathe well. So, particularly in those with severe coughs, they have recurrent chest infections, and sometimes that could lead to early death.
I'm seeing some pictures of the braces. How disruptive are these braces in Nigeria? Because this looks like they're foreign. But I mean, what kind of braces do we have here in Nigeria? How affordable is it? And how disruptive of your daily life is it? Because, you know, kids and going around with braces can be very quite funny for them.
Right, true. So the braces, which is one of the things the counseling I give to the patient, because usually they are adolescents, they are young girls, so they are smart enough. So one of the things I impress on them from the get-go is that the brace is discomforting. And it's not discomforting because it's a brace formed in Nigeria, globally, even in other climes where I've had trainings outside of Nigeria, even in the Western world. Let me be more direct now. Even there too, the girls come to clinic and complain about the discomfort of the brace. So it is discomforting. But, well, you can't eat your cake and have it. So it's just about counseling and preparing their mind to know that, okay, you have to bear this discomfort, but then it's not permanent. It's a temporary thing. It's just for this period of the growth spurt. So usually we monitor them for about a couple of years till about the age of 16. Well, we keep monitoring their bone skeletal maturity. So till they get to that point where we can then stop the brace. So just let them know that, yes, this is just for the time, it's not forever.
You wait for years.
Absolutely. So they wait till about the age of 16, 17. Usually by that time, a girl child would have attained skeletal maturity. If it's a boy child, we may want to wait a little longer. So, but like I said, in those instances, the curve magnitude is between 20 and 40. Usually those are the ones we monitor with bracing. And we've had a couple, even here, that have been managed successfully with the brace. So the brace we have here, we call it the Boston brace. I mean, Boston from Massachusetts in the United States. So that's the one we commonly use here. Some of the ones shown on the screen is the Milwaukee brace. That one is for more severe curves. So that's the one where that also tries to immobilize the neck region too. That's the Milwaukee brace. Yeah, that's one is a Milwaukee brace. Usually that is not patients that need the
Boston brace that we use here in Nigeria.
Yeah, this Milwaukee brace is not for all forms of scoliosis.
Okay.
Yes, it's not commonly needed because patients that present with this variant of scoliosis that will require Milwaukee brace are not that common. The majority, a Boston brace will just suffice. The Boston brace just takes care of the trunk alone. So the neck is spared, right? So, and they wear it under their dress, so it's not something that will be
visible. It's just the discomfort that they feel.
Yeah, just the discomfort because it's hard and then it is restrictive. But otherwise, no one would know except somebody who hugs the girl or her body will know that.
Okay, I've seen the image.
Yeah, but I hope that. Because, like you said, this is prevalent to females, right? Yeah. And I hope that the medical industry also has like a therapy program because, you know, you're dealing with teenagers and this might affect their self-confidence, their emotions, their mental state. So I hope that there's a program that is aligned to this whole treatment that, you know, teaches that supports them mentally. So during this whole process, it's important for teenagers.
I wanted to ask about the fact that how, I know this is an awareness program so that more people will know about this thing and they can be on the lookout for them. But how many of these cases do we have in Nigeria that have presented to themselves to the doctors that we are aware of? Because I don't see it often, so I don't think like, is it a Nigerian thing or maybe it doesn't happen here?
Oh, it's quite common. You never know until you come around. Virtually every clinic, we run clinics weekly and virtually every clinic, there's a new scoliosis patient presenting. So it's quite common. You never know until you create this awareness talk, then you realize that, there are people in the shadows. But then just enlightenment. Some people are just, some have been going through just physical therapy, doing exercises. People have been doing all manner of things, but not knowing that treatment is available. Then for some, they think, possibly the treatment is not available locally. They have to go abroad, whether to India or Germany or the United States or the UK to get treatment. But the treatment is available.
How affordable is it in Nigeria? Orthopedic surgeon.
I'm even surprised you are still with us.
You have not jackpot. I think you jackpot now.
No.
It's not jackpot.
No, I'm not jackpot at all. But, right, so the cost of care, for scoliosis surgery, yes, it's, you may say it's pricey, but it's still far cheaper in our environment. I know outside of here, on the average, if you step out of our shores to get surgery for scoliosis, you spend a minimum of $20,000.
Whoa.
Putting it modestly.
I calculate that one.
Yes. But here in Nigeria, on the average, if your patients hardly spend up to half of that for surgical treatment.
Okay.
Right. So it's still way cheaper
Than
here
if they
than
were to
if you have to think.
Please let me just take you away from scoliosis more, because we cannot have you and not ask about. Many people complain, maybe because we now have a lot of sedentary lifestyle, about as they get older, the bone posture and back pain and all those things. What are the things that you would advise we can do to help to manage our spine better? Because that's your. How often do we have someone that is specialized in the spine? Please.
Okay, right. So if we talk about back pain, low back pain, that's quite common.
You say it's jedi in Yoruba side.
Jedi.
Jedi, yes, there are so many things called jedi. But, I mean, there are so many symptoms. Even diabetes can be called jedi. Patients with hemorrhoids are called jedi. All manner of things. Even some people with STI, sexually transmitted infection, will be called jedi. Or some will say it's because of taking excessive soda. But it has nothing to do with that. So, but low back pain, one thing to understand is that it's very common. It's about the commonest symptom that human beings experience after headache and then symptoms of common cold. That's the third commonest symptom. Yeah, is that common? Most people, up to 80–90%, at one time or the other, will have back pain. But the good thing is that in the vast majority, it is temporal. It's transient. After a few days, few weeks, the pain goes away with or without taking medications. Now, with regards to the aging population, so right as we grow older, the changes, we call them degenerative changes, that occurs in the spine predisposes to back pain. So to a large extent, the advice we give is to maintain healthy lifestyle. As much as possible, we want to stay active. You don't want to live a sedentary lifestyle. You want to avoid smoking. You want to move. You want to be active. And then keep a healthy weight, essentially. So those are the primary things. Then, of course, the way we go about our activities of daily living, too, the kind of chairs we sit on, the kind of bed we sleep on, then you want to avoid lifting anything heavy. And then if you have to bend, the way you bend, so instead of bending over, you rather want to squat to pick things up from the floor, because usually those are the predisposing factors. You want to avoid sitting for too long, maybe in a flight or in a bus. You want to get up at intervals to move around and move your back. Right.
Interesting. So, arthritis, just like you said, we have like 1 or 2 minutes, but the use of arthritis, how soon and what can predispose you to arthritis, and how do we try to prevent it? Because it's pretty common in Nigeria.
Yeah, arthritis generally, which is all about the changes in the joints that eventually causes pain, just to put it simply, the prevalence increases with aging. There's some form of familial predisposition, now some genetic predisposition, but you can't outrightly say you want to prevent it. You can only try to just live a healthy life, maintain a healthy weight. You want to avoid obesity, and then stay active, keep your joints mobile.
Yeah. Thank you so much. We have to wrap up, but thank you so much, sir.